Fit, active, healthy, happy, enjoying the prime of your life. Looking out for your health and wellness, this is Health Talk with Fred Lowry from Lowry Drug in Statesville. Visit Fred at his store, conveniently located on Hartness Road in Statesville.
Good afternoon. This is Fred Lowry, pharmacist and doctor of medical medicine. This episode of Health Talk is pre-recorded for October the 10th, 2025. Friday afternoon. Welcome. Thank you for being here with us. We are exploring the facets of your health and hoping to keep you up to date and informed. This program is intended to share information and knowledge based on my research and experience. It's not intended to offer individual advice, nor does it place a one-on-one relationship with a qualified healthcare professional. Your daily choices are yours and have more to do with your health than anyone in the healthcare field. My hopes that this show will empower you with knowledge to take a more proactive approach to your health. Some of my sources include, but are not limited to, various Health Feeds, Epic Times, Mercola, Children's Health Defense, PubMed, and various Substack articles. We have a special guest with us today, Mariella Bashiva. She is a family nurse practitioner in the Huntersville area with the Holistic Family Medicine of Lake Norman. Welcome.
Hi, Fred. How are you?
Glad to have you here. We sometimes have practitioner profiles and individuals on the show that have some of the similar perspectives, maybe that I would have, and so Mariella has her own practice in the Huntersville area and has a lot of patients from all over the area, really. And she started really not too long ago, but has had tremendous success for many reasons. So welcome, Mariella.
Thank you so much for having me, Fred.
Oh, yeah.
I'm very happy to be here. I'm very excited, too.
Well, good.
Mm-hmm.
So, tell us a little bit about who you are. How did you get into more of the holistic medicine realm, and what's your background?
So I think my journey probably started back when I was a child. I grew up in Bulgaria. Back then, Bulgaria was under communist regime, and so we had very little, not just coupon system and what we put on the table, but we really didn't see a doctor if we absolutely didn't have to. And so homeopathy, herbs, and wisdom passed from generation, from grandmothers and grandparents, was what we were using, not necessarily the trend of a fashion statement, but just because we didn't have a choice. I feel the love for holistic approach to healthcare or treating our bodies well is back from that. It kind of goes back that when I was a kid. Mm-hmm. Now, I did come into the States in 2001 as an exchange student through Ohio State University. And looking back, I grew up as a strong person because I came to a new country. I was learning how to speak the language. I didn't have my family. I didn't have a support system. It was hard. And I survived. Mm-hmm. I made who I am today, and I still feel like that's kind of chasing me down the path of being strong and working hard for the things that I believe in.
Right. Excellent. The herbal medicine, the thing you referred to, that's the way it was here many, many years ago, and these remedies were passed down. And in some areas of North Carolina in the United States, that's still done. And it's still that type of philosophy. So that's really neat that you came from that.
I have to tell you, I remember as a kid, just like many kids here, I walked around with a bunch of warts on my fingers. My grandmother would pull a green fig from a tree, and use that milk coming out of the green fig, and they will go away.
Oh, wow.
And now what we do is we freeze them 12 times, and they just pop somewhere else.
Mm-hmm. Interesting.
Interesting, right?
Yeah, that's in homeopathy, warts are considered a miasm, and the miasm means a genetic tainting or thing that is there originally. So there are people that don't have warts, and so the homeopathic remedy for that is thuja, which is from a tree remedy. So interesting.
Mhm.
You probably have a lot of those little stories.
I do, and I feel like, and that could be one of the reasons why when I was working for a hospital system back in the days, something just didn't click. We were giving too many medications for so many chronic issues, but didn't go back to wellness. What is actually wellness, right? To support the body holistically and naturally through diet and exercise and homeopathy
Mhm.
to grow an individual that is healthy. We would catch them when it's too late and they have 20 different pre-existing conditions. Um, that's too late, right? Our hospitals are full.
Yeah, yeah, they are. So you came to this country. Your education was as a nurse originally.
Oh, yeah. So let's go back to that. So, my first degree, don't judge me for that. I call myself the forever student because my first degree is in plant protection and ecology. I have a minor in foreign trade and economics. And I have always run away from medicine until I end up in medicine. So, coming to the States for a little while, I sort of explored the ground. I figure out, I guess I'm going to stay. I entered Queen's University of Charlotte and I graduated as BSN, Bachelor of Science of Nursing, worked as critical care nurse, graduated Master Science a few years down the road, and then worked as an internal medicine hospitalist. So I covered long-term care, Alzheimer's unit. I did admission to the hospital. I also did post-surgical neuro patients, orthopedic surgeries. Um, but as I was grateful for the opportunity, I feel like something was missing.
Mm-hmm.
It was missing the listen to your patients, help the patients feel better, um, and promote that wellness.
Yeah. Well, that very diverse background, and I'm sure, like a lot of the things that you saw coming to this country, would have been really astounding in some ways, particularly like the orthopedic side and the, that may be in all countries like that, but certainly we have a lot of that here.
I feel like all of the experiences and the job opportunities I have had are helping me today to be the rounded
Mm-hmm.
practitioner I am
Yeah.
because I'm using the medical medicine background, the modern medicine with the holistic approach.
Yeah.
And
Yeah.
that is a tremendous help.
Oh yeah, absolutely. Very good. Well, we're coming up on a break, and just to your point, I think my background is similar in terms of the medicine, the pharmacy, and then becoming a naturopath because learning both sides is quite helpful. Stay tuned for more health talk. We'll be right back. Welcome back to Health Talk. This is Fred Lowry. I'm here with Mariella Bushiva, family nurse practitioner. We're discussing things relative to holistic health and natural medicine. So, next topic in terms of with this transition from regular medicine, which you're still doing, of course, but maybe with a different perspective. Um, do you have a practice philosophy in terms of how you approach patient care?
Well, the biggest thing for me, I feel creating the office as a safe space for all the patients coming in, as well as providing that ear to actually listen to what they're saying. So the biggest thing for me is don't guess, test. Listen to your patients. They know their bodies better than anybody else. Um, Put yourself in the patient's shoes. And what does that mean? I remember entering Institute of Functional Medicine a few years back. My very first project while I was enrolled was elimination diet. And so I was going into the project a little uneasy with why would I put myself into something that I really don't think I need. Well, as I went through the process of eliminating eggs, pork, beef, soy, dairy, just pretty much eating the grass outside and feeling really run down for the first 10 days, I realized that it will be easy for me to understand what my patient is going through if I experienced it myself. And so it's easy for people to throw, oh, you got to work out 5 times a week, 45 minutes at minimum. But do you know if they can? Do you know if they have energy? Do you know if they have the time? Do you know if they can afford it? So all of those things add on to put yourself in that patient's shoes, understand how they feel, listen to what they're saying, and test. Don't guess.
You know, the thing that you brought up really covers what I call resources. So people have think about resources in terms of financial aspect, but you know, resources are also the ability and the place you are at the time to be able to implement some kind of program. And some people can only do a little bit at a time. They maybe, for whatever reason, don't have the physical, mental, or emotional energy. And so that's one place sometimes supporting energetic remedies like homeopathics and things can help start. But your point there, I think, is well taken. Is you've got to figure that out. You've got to know where they are before you can ask or give direction.
Yeah, and completely right. Also, as you got to look at the other side of the story, as a provider, a medical provider, you also have to have the time to listen to what they're saying, right? In a traditional setup, patients have roughly total of 15 minutes. In the doctor goes or the medical provider, between names and checking up history and medications and what is currently going on, and they're out. That does not give the patient enough to be able to relay the symptoms and to get the help they need, even in a traditional setup.
Right.
So I feel like it's a two side of the story. So creating direct primary care gives me the time and the opportunity to figure out what is going on, test and see if there's any valuable results, and then try to personalize to what the symptoms and the results are telling me to do, and then choose the approach I would like to use.
Mm-hmm. Yeah, and I find that when I do consultations, an hour really is only the beginning of to understand, and what you're saying reminds me of this individual that I was helping one time. She couldn't sleep, and so I started asking why. Well, my dog wakes me up. So if you go to a doctor and say I can't sleep without asking the question, you get a sleeping pill. You know, it's not solving the underlying issue or understanding what's really going on with the individual. And there could be many things. So that's a very good point. So you want to jump a little bit. You were talking about testing. So what do you like to do in terms of testing labs?
It depends what I'm looking for. So in general, I get to see the patient for roughly an hour and a half. I get to talk to them bring what they have to tell me as their concerns. And based on what I hear, I like to explore blood work to kind of figure out what's going on in general. Um, I do like to do stool testing because I feel like a lot of things are happening in the gut. So that is usually part of that first initial setup. I do like food sensitivity tests. I feel like food in general can impact our bodies as well. And if we don't tolerate well, for example, I cannot eat beef. How did I find that out? My very first project with Institute of Functional Medicine. When I reintroduced beef, I found out that I have migraine headaches that I only have when I eat beef. But did you know that I didn't know that prior?
How about that?
How about that? The things we know as we actually look for the answers, listen to our bodies, are valuable.
Yeah, that commonly A blood types have difficulty with red meat. But the other thing is that I run across, well, people say, well, I've been eating that all my life.
Mhm.
But you build up this tolerance or whatever, if you will, that, and you mentioned the elimination diet, when you get away from it and then bring it back in, then you're able to see
Mhm.
what that
That
situation.
is a very inexpensive way. It's not as detailed as a functional medicine test like I like to use Array 10 or Vibrant Wellness. Those are expensive kits to test with. But if you want to do an expensively, elimination diet can definitely give you some of those big groups: eggs, coffee, um, dairy, pork, beef, soy. It definitely can show you the way. And I feel like not wanting to go through the project thinking that I'm a healthy individual, which I consider myself as a healthy one, um, still found answers about my own body that I didn't know.
Hmm. Yeah, it's an ongoing process, that's for sure. So, under the concept of wellness values, do you have like maybe a top three in terms of? And part of this, I think, is how we approach life, and with what I call intentional living. Being more intentional about what you're doing and how you're doing that. And some of these could be pretty simple too.
Um, well, it's a good question, actually. So I feel like in a fast moving society, we don't stop to take a breather, to take a moment to see what's around us. So the stress is a big part of it. So if you can figure out how to eliminate stress, which that's huge, as we're surrounded by it, um, can definitely be a good addition to wellness. Nutrition, and I don't want to talk about diet. Diet is, people take it the wrong way. What you put in your body is what you get out of it. And so I like to talk about nutrients supporting a healthy body, and think of it as fast food or processed carbs and sugars, or in general, let's put it processed foods, as the poisons that you should not intake, because that really doesn't do well. So, so nutrition, stress, sleep is a big one. I think that I recently read a research on young adults in their 30s, male, put into 30 days of insomnia or sleep deprivation, or they were just woken up, every 30 minutes to stay up through the night. They were healthy, no pre-existing conditions, and the research ended up having diabetes, gaining weight, heart conditions, brain fog,
Mhm.
inability to concentrate. So, sleep, stress, nutrition, I think that I would probably, before anything else, uh, focus on that.
Yeah. Well, stress is certainly a big part of our life, and it, it can have positive effects as long as it's not chronic, I think, because it does stimulate other things. But I think you're right about this society. We're we're on go all the time, and constantly stimulated by computer, phones, etc. So, very good. And food certainly plays a role in that. When we come back, we're going to get into some of the maybe hormone aspects of this conversation in terms of men and women's hormones, thyroid, adrenal function, and more. So stay tuned for Health Talk.
Doctor, my eyes have seen the years.
Welcome back to Health Talk. Fred Lowry. I'm talking with Mariella Bushiva about current world of medicine. You know that, Mariella, one of the things that feels pretty good about where the whole situation, well, maybe not the whole situation, but health in general, is that I feel like we're in a little bit of a wellness revolution now. People are learning more about it, learning about the things that they can do, that they can take a more of an approach of and responsibility for improving their health position, and that feels good after all these years.
I feel like people are getting woken to it, and that's kind of sounds a little cheesy, but I notice it and I talk to Sharon, who is the medical coordinator for the office, all the time by the way the phone rings in the office, by the demand. I feel like people are looking for better and for optimal health.
Sure, absolutely. So one of the things that I think you're maybe passionate about is helping men and women with hormone balancing, which includes the things that we think about: estrogen, progesterone, testosterone, and thyroid health. And so tell us your process for that, and how do you go about evaluating individuals for, do they need it, or they,
I have to tell you, Fred, that I was in a concept of exploring direct primary care and staying in that little, well, it's not little, actually, direct primary care is a pretty good, broad approach to health. But through the years, I have seen that there is lack of coverage in hormonal health. And what does that mean? That means that a female will go to the doctor's office and she will say, I'm not sleeping, I'm gaining weight, I'm irritable, I have hot flashes. And they will look at her and says, well, your labs are normal, and why don't we just prescribe you antidepressants? And so after hearing this similar situation over and over and over and over again, I decided no more. My patients will not go through this. I feel, especially in women, men, for whatever reason, they have a little more coverage, or maybe it's more established. I think women are overlooked. But I do take care of both men and women by helping them achieve that hormonal balance.
right? You know that antidepressant approach is really such a bad idea in terms of the concept of weight gain and messing with brain chemistry and neurotransmitters, and it's negative to libido. It's just, it doesn't cover the underlying issue, which the fact is, as men and women age, our hormones diminish, and our wellness and our overall health is part of that, and it's so encompassing, in terms of mental well-being, physical health, muscle mass, bone. It's a big subject. So, what's your approach? Do you use testing for that, or
I always test. However, when a patient is sitting in front of me and describing their symptoms, I kind of know what's going on. But I always like to test simply because I need a baseline. I need to figure out where we're going, where we're going to stop. I do mostly blood work because it's inexpensive, and I like to support my patients financially as well, not necessarily paying their bills, but finding a cheaper way to get results and testing done. In some cases, I will use saliva. Those are more expensive testing, and if I don't have to, I will not use it. But in general, blood work will usually give me enough data, and the patient's symptoms will help with that, where I can get a whole picture of what's going on.
right? Now, how do you the difference between men and women testing is? I mean, obviously, there's a big difference in male hormones and female hormones. The old adage of there's just an on and an off switch for men, and the female has all of this complexity, and which is absolutely true.
It is. It is. It's funny. They represent with different symptoms, first of all, because I have to talk to them first. It's very funny to say, but when women come looking for answers, there is going to be irritability and not sleeping probably first. When men comes look for answers, it will be midlife crisis, I'm depressed, which sounds funny because a lot of people think it's always the libido, but that is not the case. Talking about hormones and mental health in men is a big part of it, because when men has low testosterone, they usually will have low mood, low energy, muscle mass will not be where it used to be, and they will not feel happy. When women have a low progesterone, they will not be sleeping well, and when they have low estradiol, they will be dealing with the hot flashes, the vaginal dryness, breast tenderness. So the symptoms are different. The testing will come back also different, and I don't necessarily look for the ranges. What they talk about normal versus optimal. I'm shooting for the optimal, not the normal.
Right, and that is so true in terms of particularly blood labs, because you have a range, and as long as you're in that range, then you're supposed to be okay, and that's really not true for many reasons. But one piece of that is that as these ranges are derived from averages, and as people have gotten sicker, those ranges have been expanded to accommodate that mathematical formula. So and typically, I'm sure you see it in thyroid patients a lot in terms of labs.
I have to tell you, you brought the ranges. Just because you feel good at level 2 for whatever I'm testing, that
Right.
doesn't mean I will. We're different people. We feel different at different levels. So that is why I feel like I am helping my patients achieve better outcomes as I target that personalized care. I'm not really trying to put you on a paper range normal. I'm trying to optimize everything I see it's not and get you to feel better.
Right. Yeah, very good point. I learned that many years ago with testosterone levels, because 400 with some men might be just fine, and 800 would be off the chart for them. But by the same token, some men feel better in a higher range, and the behaviors may not be different. They could be, but so like with men, what's the range? 300 to 1200. That's a big number.
It is a huge number, and for you to be testosterone deficient in an insurance, and we have not talked about that at all, but in insurance-based situation where insurance actually covers the product, you have to meet that low criteria. Well, if somebody already feels low at 300, they're definitely going to feel low at 290, whatever the criteria is. So we don't have to be at the bottom of the barrel to call it deficient. The bottom of the barrel for us can be somewhere much higher.
Yeah, yeah, very good point. So, and coming up on a break here, but the thyroid, I think, is one of the bigger things because, you know, and we'll talk about that a little more. So the most common measurement is TSH.
Completely misunderstood, if you ask me.
Yeah, it's a
And
lot
overlooked.
more to it than that, and that plays such a big role. Stay tuned for more health talk. We will be right back.
Doctor, my eyes, tell me what is wrong, 'cause I am wise to leave them open.
Welcome back to Health Talk. This is Fred Lowry and Mariella Pashiva, family nurse practitioner. We're talking about all things related to health. Now, when we finished up, I was talking a little bit about thyroid, and one of the things that typically happens with women that are in menopause and perimenopause, in terms of the way they feel, and they start the hormones diminish. Things get difficult. The weight gain comes on, and it's like you were doing all the same things that you've always done, but now it's different.
Mm-hmm.
And you're looking for answers. And thyroid is a big part of that, and the stress that may be associated with that. Cortisol suppresses thyroid function. and you go have your labs done, and they're normal, but you don't feel normal. So how do you approach the thyroid aspect?
So you're right. So thyroid always goes on that very first blood work or panel that I order for patients that come to me with intentions to figure out what the hormones, and thyroid is a hormone, what the hormones are actually doing. Now, when a patient goes to a normal primary care setting, the testing they do is limited. I've been in the system, I follow the protocols, and I've learned that that is not all we need. We kind of have to figure out a little bit broader and see if they're having any antibodies. Are we dealing with autoimmune thyroid issues? The biggest marker for me that I can see that fatigue and that metabolism shut down and the hair falling, the brain fog. I like to utilize T3 free, which may sound Chinese, to the people listening, but there's a panel I use to figure out if the TSH is normal or the normal lab that they use for thyroid, what is not, so I can feed it to promote better outcomes.
Yeah, and so that's a good point. Even with bioidentical hormone replacement or thyroid, we're basically trying to identify, pardon me, what you need. What are the building blocks that you need to function with your hormones or your thyroid, and providing them.
I want to tell you, I give an example to my patients to kind of get a little more out of medical terminology. And I ask them, you are 50 years old. Would you like to feel 50 or 60, or would you like to feel 20 or 30 again? By optimizing your levels, by optimizing your thyroid, by putting back testosterone in your body or giving you some estrogen or whatever that is that you're lacking or it's diminished or depleted in your body, I'm giving you the 30 back, the way you want to feel. And so I feel like that is the difference between optimized ranges versus follow the normal range category.
Right. And why do you think thyroid may be misunderstood overall, and how important it is in terms of function?
I feel like the misunderstanding comes in just from the way we're testing it. And because I see how it improves once we optimize it, then I have no desire to just test that one number. I tell my patients all the time, yes, it is in a normal range, but look at this, this, and this. It is not. Let's fix the one that it's not,
Right.
and let's see how you feel. And 99.9% of the time, that is the key.
Right. And what do you like to use as a thyroid product?
It's funny you say that. I do like to compound all of my hormones. I do see compounded medications. I use a lot of bioidentical hormones. Actually, that's the only thing I use. I use desiccated thyroid. I like to compound it because I look at compounding medication as pure, clean. My patients thrive on those type of support.
Right. And one of the reasons I asked that, because I wanted to bring up, the desiccated thyroid thing, that a few weeks ago I did a program that talked about that, and that the FDA is trying to eliminate that now. And you can, there's so many people that do so much better on desiccated thyroid than the standard levothyroxine product. And it's because that doesn't have the T3. So there is a petition out there. You can go online to change.org and sign that. And hopefully, we've been given a year to transition patients away from that. But hopefully there will be enough outcry that the FDA will make a change in that. And
You're going to have to share that link with me because I have quite a bit of patients that will probably jump on that because they're not going to want to part ways with their desiccated thyroid.
Yeah, it's very effective. Yeah. So we've kind of got that covered. How about hormone connection to mood and mental health, and then we can get into neurotransmitters and how you've used some of the serotonin and antidepressant kind of products like that.
Well, you just said it, neurotransmitters. Hormones affect the neurotransmitters in the brain. That is serotonin, dopamine. We're talking about GABA. And when that's off balance, the entire body is off balance. Remember, we talked about early men in depression. Once everything is suppressed, then you don't have enough for that bliss to happen anymore. Yeah. So I consider by optimizing hormones, by optimizing thyroid, that the mood will be back where it's supposed to go, and we are not going to have to deal with depression and anxiety and irritability. As a matter of fact, my office is located, actually connected to a psychiatrist office, and I will often get referrals from their providers for depression. They have done, patient is already medications or injectables or whatever they're treating it with, but on the back of their mind, they think their hormones are off, so they'll send them to me to try to optimize what we're dealing with, and then the patient is on the other side.
Right. And hopefully, if you can remember what it was like to be in your 20s and your 30s, and you just really, none of this was even a thought, but your hormones were optimal at that point, and they were at the highest level at that point. And so when you think about that, how is it in terms of safety, comes up a lot, so how is it that the teenager with raging testosterone doesn't get prostate cancer, or obviously there's so many nuances to that and pieces, but what about safety issues like that? What do you think about that?
That's probably the most circulated question around. As a matter of fact, if you look at my portal messages, there will definitely be one there sitting. I'm getting on estradiol. Is it safe? So I have to tell you, so there is a study that was done, Women's Health Initiative 2002, completely different category of women, synthetic hormones. Since then, that study has been debunked. But what has happened is the media ran with the alarming data, and it's still lingering in today's news and search engines, and patients constantly ask, is it safe? So if you go to bigger groups, I like to follow North American Menopausal Society. They will actually, make statements such as, if started early, if bioidentical hormones used, if monitored correctly, it's not just safe, it's proactive and it's beneficial.
You mentioned that study. The one of the biggest differences that I've seen over the years is most of the negative aspects of hormone health had to do with the altered progestins, not progesterone. It was the medroxyprogesterone. Those, and the same is true for oral contraceptives, is those altered progestins are the ones that cause most of the side effects. And the best example of that is natural progesterone, which we use as bioidentical hormone replacement. If you want to look at the contrast, that hormone maintains pregnancy. If you give medroxyprogesterone, you'll abort the baby. It's just two different things, and the news has never got it right, and people get that confused all the time. We give progesterone to maintain pregnancies, and that's part of the balance of the whole system with the estrogen and everything.
You just brought something up, and I'm going to share it. I had a patient come in to me a couple of years ago with 3 consecutive miscarriages. And she was desperate. She was scared. She was into trauma. Mm-hmm. Well, we have a 9-month-old healthy boy today.
Great. How about that? Mm-hmm. This has been really good. Glad you came. We'll have to get you back. So we're with Mariella Bushiva, family nurse practitioner of the Holistic Family Medicine of Lake Norman in Huntersville. What's the contact phone number there?
980-317-9993.
Okay, one more time.
980-317-9993. Okay. Fred, thank you for having me today.
Yeah,
it was a pleasure.
Great conversation. Thanks for listening. Stay tuned for next week, and everyone have a great weekend.
Thank you.